Into our final segment here on WAJR's Ask the Experts. Tony Caridi with Jeff Sandy of HealthWorks Rehab and Fitness. Our topic today is the anterior cruciate ligament. You probably know it by the ACL. What happens if you injure it? What's it look like as far as recovery goes? Is surgery always necessary? Some of the points that we've hit upon. Earlier in our first segment, Jeff, you said that there are exercises people can do to help themselves avoid an ACL injury. What are some things we could do at home that can help us stay away from a potential knee surgery?
Yeah, so many of the things are very basic. So let's start at the hips, for example. So some of the most basic hip exercises you can do is something called a bridge. So basically that's bending the knees up, lifting the hips off a surface. There are also things like clams, laying on your side and doing a leg raise, doing what we call a straight leg raise, where you keep your knee straight and lift it off of a surface. And most of those exercises, the nice thing about that is you can find that information on Google, YouTube, those sort of things. So if you just do a simple search, all of that stuff will pop up. It has video demonstrations. Our HealthWorks YouTube page also has video demonstrations of some exercises. If you don't feel comfortable with that, though, there's always an opportunity that you could talk to your doctor and say, you know, I'm a little worried about my knee. It hasn't been feeling right. And you can go in and get evaluated by a therapist, and they can give you specific exercises as well. Mm-hmm. And then also for the knee, a lot of times what you want to think about is strengthening that quad muscle. So like I said, the muscle in the front of your thigh. And that can be something as simple as doing a little mini squat at your counter.
So you mean two hands on the countertop, do a little bend, help you don't need to go all the way down without your hands, right?
Exactly. And depending on your fitness level too, you know, so if you're an athlete versus a non-athlete, that could change the type of exercises you're obviously doing. Athletes are obviously training and exercising all the time. The other major thing that can help with ligaments, and what this could be the ACL, this could be any ligament in your entire body, is balance training. So being able to balance and adapt to surface changes. So that can be something as simple as standing at your counter, again, where you have your hands for balance on the counter if you need it, but standing on one leg, closing your eyes, seeing if you can hold your balance. If that's too hard, standing with your eyes open on one leg. Also adding an uneven surface, so that could be a pillow on the floor and stand on that. So balance training, or what we call proprioceptive training, which is a fancy way of saying your body knowing where it is in space, all of those things can really help you avoid injury.
What muscles are those type of exercises working on when you stand on one foot? What were we impacting?
So many different things. So humans adapt or have adopted what we call an ankle first strategy for balance, meaning if we for balance we rely first on our ankle and our foot. When that begins to fail us, it moves up the chain to our knee, eventually the hip, and then your upper body. Obviously, if you're getting to the point where you're at your upper body, it's probably too late. So all of those muscles from your toes all the way up to your hips help with balance. The other piece of it is what we call sensory. So there are little nerve endings in your joints, sensory nerves that give information to your brain. And that they tell your brain whether your foot's pointed, whether it's down, whether your knee is bent, whether your knee is straight. All of those signals go to your brain and help you adjust to varying conditions. So it could be making a cut during a game, could be stepping down out of a truck unloading firewood, or even just going downstairs.
What are some of the enhancements that HealthWorks offers for folks dealing with this?
So at most of our HealthWorks clinics, we do offer A-stem therapy. So that's a type of soft tissue technique that uses specialized tools that has been shown to decrease scar tissue, decrease pain, improve recovery. We also offer at our clinics blood flow restriction therapy, which I think Travis Rummel was on last month and talked about with you. We offer that at all of our clinics at HealthWorks. That's something that has been shown to help, accelerate recovery, decrease post-exercise soreness, all those types of things.
Yeah.
And then we also have things like dry needling, compression devices, recovery pumps, all those kind of things to help your body recover quicker.
There's a lot of new things, aren't there, that are out there that just didn't exist in the past?
Yeah, definitely. And it's constantly changing. It seems like every year we find something new that we want to try or we want to use. So
yeah. So if you or someone that you know has been dealing with an ACL situation, it's not as bad as it used to be. And as Jeff has pointed out here, there's a bunch of ways that you can make yourself get better quicker and potentially prevent an injury if you get real proactive as we all get older. Well, very good. Jeff, we encourage folks, if they've got any questions, to go to the HealthWorks website. And you can also call the Morgantown location, 304-599-2515. That's 304-599-2515. And they'll be more than happy to help and to guide you. Jeff, thanks so much for being with us. We appreciate it.
Yeah, my pleasure.
Jeff Sandy, Clinical Director at the HealthWorks location in Buckhannon. That'll do it for us. We invite you to stay tuned. Ask the Experts, sponsored by HealthWorks Rehab and Fitness. More coming your way here on WAJR.